So let's talk about antacids. Antacids are the oldest drugs in the treatment of people that had acid-related disorders. These are the principal anti-ulcer treatments until H2 antagonists came out in the 1970s. There are systemic antacids, such as sodium bicarbonate, but that can cause metabolic alkalosis, or the person's pH rising. Non-systemic are more commonly used. Aluminum compounds, they have a low neutralizing capacity and a very slow onset of action. Large doses are usually required and rarely used alone. Magnesium acids have a high neutralizing capability and a rapid onset. These are contraindicated in renal disease. They can cause high blood magnesium levels. Calcium has a rapid onset, rarely used in peptic ulcer disease. Calcium carbonate is effective in relieving heartburn. It may be most effective in neutralizing acid, but 1/3 of the calcium can be absorbed into the system and can cause rebound, increased gastric activity, and kidney stones. So individually, those specific chemicals and compounds on their own are not real good. Combination antacids are more common, and usually will combine aluminum hydroxide and magnesium hydroxide. Well, why do that? Well, the basic aluminum magnesium combination is called Malox. Malox plus is the aluminum magnesium plus simethicone. Why would we add simethicone? Simethicone is used to break up gas bubbles in the stomach. I remember when my children were babies and they'd get little gas bubbles stuck, and patting on their back doesn't work, so you give them a couple drops of simethicone and those bubbles just dissipate. Adults can use simethicone too. So that's why we would use simethicone, to get rid of those gas bubbles. Why do we combine aluminum and magnesium together? Well, the side effects of each of those are the exact opposite. Magnesium, which is used in milk of magnesia, that's a laxative. So magnesium can cause diarrhea. Aluminum can cause constipation. Together, they reduce acid with fewer side effects. So again, some of the side effects of these various compounds: magnesium, diarrhea, and high blood levels of magnesium. Aluminum, constipation is a problem. Calcium has several side effects. Constipation is a big one. Calcium is found in Tums. And think about how many Tums people will chew when they're having problems. You can go through a lot of Tums very quickly. All that calcium builds up can cause constipation profoundly. It also can cause kidney stones because some of that calcium will be absorbed systemically. We want to be very careful to use antacids that are high in sodium if a person has high blood pressure, heart failure, or has a sodium-restricted diet for whatever reason. Antacids can cause drug interactions because they bind with other drugs. When we give an antacid in the presence of other medications, we're going to have a 1 to 2 hour window between the medication and antacid and another medication. When antacids are given with food, they have a neutralizing action for 2 to 4 hours. When they're given on an empty stomach, the neutralizing effect is only about 30 minutes. So if a person has chronic problems when they eat food, you want to make sure you give that antacid with food. That'll give them long-term relief. If they have heartburn at bedtime, you just want to neutralize that acid quickly so they can go to sleep. We're going to make sure we give at least 8 ounces of water with these medications to increase absorption. Now earlier I said that there's no evidence that caffeine or alcohol or other foods cause peptic ulcer disease, and that's true. There's no evidence that they cause them. But caffeine, alcohol, spices, black pepper can aggravate an existing ulcer. So if a person already has problems, caffeine and alcohol and spicy food will simply make the problem more present. So again, we're going to encourage lifestyle changes while the person has these conditions. Histamine H2 receptor antagonists. These were the first non-antacid antacid. Cimetidine was the first, came out in 1975. It blocked about 70% of acid for 4 hours, which was good. It decreases the release of acid. You're not having to neutralize the acid that's already there. You're just preventing more acid from coming out. So that's good. But Zantac came out, and it's better. It's 5 to 12 times more potent than cimetidine, with fewer side effects and fewer drug interactions. And then Pepcid came out, famotidine. Now, have you noticed cimetidine, ranitidine, famotidine, tidines are histamine 2 receptor antagonists. Remember that. Tidines are histamine 2 receptor antagonists. So we have cimetidine, ranitidine, and famotidine. Side effects are generally minor, although we're going to talk about cimetidine in just a moment. There is some significant side effects there. These are contraindicated on people who have renal disease. If a person has a duodenal ulcer, it could take 4 to 6 weeks to heal. 8 to 12 weeks to heal a gastric ulcer. So people could be taking these for a long duration. They're usually given as a single bedtime dose, which is convenient for our patients and residents. Make sure that if a person is getting, let's say, a prescription Pepcid, that they're also not taking over-the-counter Tagamet. That's going to cause problems. Now, in general, the side effects, which are minor, will be diarrhea or constipation, headache or dizziness, flushing, muscle aches. It can cause increased BUN, creatinine, those are renal labs, or liver function tests, AST and ALT. Here's a major patient teaching though. If your patient or resident smokes, smoking interferes with the effect of an H2 receptor antagonist. If you're going to smoke, you may as well not use an H2 antagonist. It's just not going to work. Now I said we had some specific side effects for cimetidine. Cimetidine was the first of the H2 blockers, and brand name is Tagamet. Cimetidine enhances the effects of benzodiazepines, xanthine derivatives, beta blockers, phenytoin, lidocaine, calcium antagonists, tricyclics, and warfarin. So if a person is on those medications and they take cimetidine, they will have more side effects from those medications, or greater effects, greater sedation, greater everything. That's a problem. That's not what we want to see. The other thing is side effects that can happen in addition to everything else that an H2 receptor has. This because cimetidine binds to androgen receptors, which produce a receptor blockade, this can result in gynecomastia, reduced libido, and impotence. So if you have a male patient, this might not be the best choice. Now, will your patients get these side effects? No. No guarantees. Can they? Certainly. And that's the problem. You don't know who will get which side effects. This is a side effect that would probably prevent people from taking this medication. Well, if you're taking the medication to get rid of an ulcer and you stop, the ulcer doesn't go away, it just gets worse. So this is an important patient teaching and the side effect that we need to take into consideration before we suggest that a person take this. Or we wouldn't suggest. We would work with a doctor on that. Proton-pump inhibitors were the next generation. These block production of all gastric acid. These are much superior to the H2 receptor inhibitors. These cause irreversible inhibition of an enzyme that generates gastric acid. A single dose reduces production of gastric acid by 97% within 2 hours. Now I said irreversible inhibition. That's for the duration of that enzyme. Partial recovery of acid production begins 3 to 5 days after the last dose. So we're not talking one dose forever. But while you're taking it, you are going to reduce almost all the gastric acid. So side effects of these are generally infrequent and minor. It heals most ulcers in about 4 weeks. It can also be used long-term to maintain healing of the gastric and duodenal ulcers and prevent reoccurrence. Prilosec, or omeprazole, was the first of these PPIs. Eventually, we also developed lansoprazole, pantoprazole. Now, if you noticed, azoles are proton pump inhibitors, just like tadines are H2 receptor antagonists. Protonix and Nexium are very convenient. They're once-a-day dosing. Lansoprazole, or Prevacid, that's unique. All these other medications are enteric-coated. You want them to dissolve in the duodenum, in the small intestine. Lansoprazole is in a capsule, and that capsule can actually be opened and emptied out onto applesauce or ice cream or whatever your patient or resident wants if they cannot swallow tablets. That's an important thing to remember. If your patient has a problem swallowing, you'll want lansoprazole, not any of the other ones. They cannot be crushed or chewed. PPIs are the best choice to promote healing. They're also the most expensive. So side effects, less than 1% of your people will get side effects. And usually it's going to be diarrhea, headache, dizziness, abdominal pain. They should be taken 30 minutes before eating, usually before breakfast. As I said, they are enteric-coated except for lansoprazole. So enteric-coated tablets should not be crushed. They should not be swallowed. They should not be chewed. They need to be swallowed whole. They need to be dissolved in the small intestine. These medications can be given at the same time as antacids, so Maalox. If a person cannot take anything by mouth at all, Protonix is the only proton pump inhibitor that can be given IV, and it'll be given usually via piggyback. Prilosec, okay. Protonix may also increase serum levels of diazepam, dilantin, and cause increased chance of bleeding with warfarin. So it will be used carefully. But these are the medications of choice when you want to heal ulcers. Now let's just do a quick comparison. Antacids, H2 antagonists, and PPIs. Antacids chemically neutralize the acid. H2 agonists and PPIs prevent acid secretion. PPIs prevent almost all acid secretion. Antacids are as effective as an H2 antagonist, but they have more side effects and drug interactions. So, Tums or Pepcid, same effect. Tums has more side effects and drug interactions. H2 agonists are cheaper than PPIs and do not take these with antacids. PPIs are the most expensive. They're the most effective at decreasing acid suppression, and you may take these with antacids. We have a range of treatments here. And it's important to have that range and to understand your patient, your resident. What's their financial status? Do they have insurance to pay for medications? You can't really ask that, but in talking with them, you'll get that information. If they can't afford a PPI, because they are expensive, go to Walmart and check the difference in price between a PPI, which you can buy over the counter, and an H2 antagonist, which you can buy over the counter. And then compare it to Tums. So those are things that, as nurses, we have to always take into consideration when working with our residents and our patients. We want the best possible treatment for our people, but we want the best possible treatment that they can take and afford. Just things that, as nurses, we're always considering. Why don't you come back and we're going to talk about mucosal protectants next.